So are the Democrats getting it wrong? The White House has said the recession is over, but is it really over if so many millions of Americans are still out of work? Joining us now for the face-off, Chris Kofinis, Democratic strategist, and Republican strategist Doug Heye joining us. Gentlemen, if we can, following this week's gubernatorial race in two states, New Jersey and Virginia, where voters there said the economy was the top issue and the Republicans won in both cases. Chris, I ask you right now, are the Democrats at this point responsible for an economy that hasn't turned around yet with the unemployment continuing to fall?
I don't think they're responsible. I mean, listen, you end up being responsible because when you're in the White House, the American people are going to look to you to lead the country out of crises. But, you know, let's be honest about the facts. President Obama inherited a series of crises that were unprecedented. We were losing about 700,000 jobs at the beginning of the year. Now we're falling down to about less than 200,000. It is still a serious problem, especially for the millions of folks that are unemployed. But in terms of turning the corner, you saw, GDP growth last quarter up 3.5%. So we're slowly starting to turn the ship, and there is a lag effect, unfortunately, between GDP growth and employment gains. But we're moving in the right direction. But at the end of the day, it doesn't make a lot of people who are unemployed feel much better.
So, Doug, we ask you: is the stimulus working? The Democrats spent a lot of money to try to get this country going again. Is the big government policy working right now for the Democrats?
Well, the bill certainly had a lot of money. What we've seen is that a lot of the stimulus money hasn't been spent yet. We've heard about save jobs. We've heard about prevented depressions from Vice President Biden, but it's a bit like saying that you saw a unicorn. It's nice to talk about, but it's really hard to justify, and you cannot prove it. But Pete, I'd agree with Chris. It's very real if you're out of a job, if your spouse is out of a job. Earlier, I was the press secretary to the Small Business Administration, and I saw firsthand visiting small businesses throughout the country what they need. They need less regulation. They need less taxes so they can hire people. They need access to capital. Those are the kinds of things that we should be doing in this health care bill, and cap and tax just does not do that.
And speaking of health care, guys, we want to switch you to topic two. And Doug, I'll start off with you because you Chris, I'll let you know right now, Doug sent me an email earlier with his talking points he'd like to address in this. And Doug, his clip notes, Doug, you sent me this, what you wrote, that the Democrats don't have the vote. They can lose 40, and you believe that Nancy Pelosi does not have the 218 she needs here.
Right now, she doesn't. The Democrats have said, they keep pushing the vote back every month, every day.
We should update our audience. There is some reporting, including information we have here, that there may not be a vote today, this weekend. It may extend into next week now. Yeah,
color me shocked. Really what we've seen is the Democrats have said they're about 10 votes short. Why is that? Because they've lost 10 votes since these elections have happened. You see members of Congress, congressional Democrats from conservative and moderate districts who are clearly uncomfortable with this. Members from Virginia, members from New Jersey, just pick two states who have stood up and said they won't support it.
Republicans being pessimistic about health care reform, that's a surprising revelation.
But it's
Democrats who are dropping
You've got some Democrats, including in the Latino community, for example, who say that if there's something in this bill that prohibits immigrants from getting health care, that they will not sign off on this. So it's not just the Republicans here.
Sure.
Which we expected.
Right, but here's the reality. When you're talking about big, bold reform to deal with a problem that has been ignored for years, that the previous administration, the Bush administration, did nothing about, that the Republicans, when you just saw they came out with a proposal, it left basically every White House, is a very serious, sometimes difficult process, but serious effort to pass health care reform for the first time in a dramatic way in this country's history. And I think we need to kind of sometimes step back and put that in perspective. Now, in terms of whether we're going to have the votes, listen, I am confident that we are going to pass health care reform this year out of the House, out of the Senate, and it's going to get signed into law. And then the Republicans can go out there and complain about how insuring tens of millions of Americans was a bad thing.
Doug, get in there.
It's not Republicans who are complaining, it's voters who are complaining. Look, if I'm a congressional Democrat from a moderate or conservative district, say Tom Perriello, who's a freshman from rural Virginia, and Bob McDonnell carried my district pretty strongly, I don't want Nancy Pelosi pushing health care votes and cap and trade votes that I'm not comfortable with and pushing me off a political cliff. It's just not safe.
In response to that, in response to the notion of this being a bad political vote, what I would say to any centrist or moderate member who's concerned about this is the best politics is good policy. If we pass good policy, and this health care bill is good policy, and it's going to get better as it goes through the process, the American people are going to reward you for that. That is smart politics.
One quick thing, Cameron.
In Nevada, we're out of time. Go ahead, quick.
In Nevada, Danny Tarkanian, candidate, has filed an initiative to prevent any type type of public option to be done. Look at the state level. You'll see a lot more activism going on that fashion.
Well, we're looking ahead to what will happen over the weekend. Thank you both.
Thank you.
Chris Kofinis, Doug Heye, thank you very much. Coming